Chapter 29, Sulfonamides and Nitromidazole Antibiotics. Sulfonamides, these are synthetic antibacterials and one of the oldest antibacterial agents used to combat infection. They work to inhibit the bacterial synthesis of folic acid, are considered bacteriostatic and effective against gram-negative bacteria. Used for things like otitis media, meningitis, malaria, as well as respiratory and urinary tract infections. Side effects would include things like anaphylaxis, blood dyscrasias, photosensitivity, headaches, edema, GI distress, stomatitis, insomnia, rash, arthralgia, hematuria, and elevated hepatic enzymes. Nitromidazoles disrupt DNA and protein synthesis in bacteria and protozoa, effective against things like H. pylori, Clostridium, Giardia, Peptococcus, bacteria species, as well as Trichomonas. Nitromidazoles are usually reserved for those complex organisms, Clostridium difficile, Giardia, Trichomonas, treating gynecologic, skin, intra-abdominal, bone and joint, and respiratory infections. It could also be used for things like endocarditis, meningitis, H. pylori, as well as surgical infection prophylaxis. Some side effects would include things like anaphylaxis, headache, dizziness, insomnia, weakness, dry mouth, tongue discoloration, peripheral neuropathy, on up to seizures, as well as disulfiram-like reactions. When giving sulfonamides, we want to assess the patient's renal function and determine whether the patient is hypersensitive to sulfonamides. We also want to assess baseline lab results, especially CBCs, and analyze cues such as tissue injury, nausea, vomiting. We want to administer sulfonamides with a full glass of water. Carefully monitor the patient's vital signs as well as intake and output. Keep a close eye out for hematologic reactions as well as signs and symptoms of superinfection. Make sure the patient's not taking with antacids 1 hour before or 2 hours after to ensure adequate absorption of the medication. Patients also going to be advised to wear sunglasses, avoid direct sunlight, use sunblock, and wear protective clothing when in the sun. For some of our miscellaneous antibacterials, chlorophamnicol does not belong in any major drug group. It works to inhibit bacterial protein synthesis and is effective against both gram-positive as well as gram-negative bacteria. Used for everything from respiratory and skin infections to bacteremia, meningitis, or salmonella. Even anthrax, rickets, or typhoid fever. It has side effects, anaphylaxis, headache, confusion, GI distress, nephritis, glossitis, or superinfection. Dalfopristin. This works to disrupt bacterial protein synthesis, used for things like Staphylococcus aureus, and treating skin infections as well as bacteremia. Adverse effects, that's superinfection that you're going to see with almost every antibiotic. C. diff, arthralgia, myalgia, hyperbilirubinemia, or edema. Obeltoximab works to inhibit the binding of protective antigens of a bacterial toxin to cellular receptors, preventing the lethal factor of anthrax from intracellular activity. Again, treating anthrax and would have side effects such as headache, cough, nasal congestion, hematoma, injection site reactions, rash, pruritus, or GI distress. Lifamulin inhibits bacterial protein synthesis, can be considered either bacteriostatic or bactericidal, and used to treat things like community-acquired pneumonia, Staphylococcus aureus, chlamydia, Legionella, and also have reactions such as headache, injection sites, GI distress, hypokalemia, and elevated hepatic enzymes. For our first practice question, which of the following is the highest priority when teaching a patient about trimethoprim sulfamethoxazole? Would that be A, increase fluid intake, B, report signs of ringing in the ears or loss of hearing, C, expect the color of the urine to change to a reddish orange, or D, take this drug with dairy products or antacids to protect the stomach? And that answer is going to be A, increase fluid intake. For practice question 2, the patient is taking the same drug and realizes that this drug most likely used to treat which condition? A, gonorrhea, B, rickettsial infection, C, chlamydia, or D, urinary tract infection? And that answer is going to be D, urinary tract infection. And for our final question, which of the following is sulfasalazine most often used to treat? That be A, fungal infections, B, ulcerative colitis, C, yeast infections, or D, skin infections? And that answer is going to be B, ulcerative colitis. But anyway, that's all I got for this chapter. I'll see you in the next slides.